Let's do it.
Welcome to Curitics Conversations. I'm your co-host, John Gorman. This is going to be a conversation with leaders who've spent decades building, scaling, and fixing some of the most complex parts of healthcare. I'm thrilled to be here with my co-host, the incomparable, unmatchable Unmesh Srivastava.
Good morning, John. How are you doing,
Great,
sir?
brother. So pleased to be here with you.
Absolutely. It's going to be a fun conversation, and really looking forward to the series as we get kicking off with some great conversations.
We're going to introduce ourselves today. We're going to share some stories that shaped us and give you a preview of what this podcast will explore. So I'm John Gorman. I am a 35-year veteran of the healthcare industry and Washington, D.C.'s political machinations around healthcare. I still live here in D.C. on the same street for the last 30 years. I started here fresh out of school, working for my hometown congressman from Detroit, John Conyers Jr. Started as his press secretary, became his chief of staff about a year after that, I was helping to run President Clinton's campaign in Michigan. And when he won, I was appointed to what was then the Healthcare Financing Administration, now, of course, today, the Center for Medicare and Medicaid Services, or CMS, to help open the first office of managed care. So we had to set up all the infrastructure for managing the Medicare risk and the Medicaid HMO programs at the point of their greatest growth back in the early 90s. So I did that for the first term of the administration. And when I left, I founded Gorman Health Group, which was a consulting company focused on government health programs. And over the next 23 years, GHG came to be probably one of the biggest shops around in government programs, with literally hundreds of consultants and over a dozen spin-offs of technology and outsourced services companies that we spawned. The biggest one of which that you may have heard of is Signify Health, which is now owned by Aetna CVS. I sold the whole empire in 2018, retired. That was very short-lived. Opened Nightingale Partners, which was the first venture fund to focus on early-stage companies in the social determinants of health space. And another unique thing about Nightingale was that we used the Opportunity Zone program, the big tax shelter that came out of Trump's first big tax giveaway bill. And it was designed to encourage investment in underserved communities. So we used the Opportunity Zone funding in virtually every large intervention and project that we did. And after 2 years, I sold Nightingale to our biggest investor and stayed on as chairman to oversee our legacy investments until I joined Unmesh and his amazing team here at Curitics and in QVO Health. So with that, Unmesh, give us a little backstory.
Well, let me start with, we are so lucky to have you working with us, John. My background is not as deep as yours, but I've had my share of scars. I've been in U.S. healthcare for close to 20 years. All this time, I've been running technology transformations, digital transformations across big, small enterprise startups. I've seen the spectrum. I'm an immigrant. I was born and raised in India, came to the States when I was 20 years old. And, I stumbled into healthcare. My mother is a primary care physician. And while growing up, it's so interesting. When I was seeing my mom while I was growing up, I'm like, hey, this is one thing I don't want to do, because it's a public service to be in healthcare. But, that plan didn't work of not going to healthcare. I landed at Kaiser Permanente in 2010. And, what was starting out to be like a sabbatical, 1 year job at the nearby office, just kept going. I spent 3.5 years at Kaiser. Post that, I joined a smaller organization called Prime Care, which was a medical group, and also had a MSO called NAM. We were taking risk for 60,000 lives. We ended up in a M&A transaction selling the organization to Optum. Back in the day, it was called Optum Health Collaborative Care. Now it's Optum Health, Optum Care. I stayed close to 9 years there with United Health Group and Optum, and at one point was leading all of innovation for California and Pacific West. Um, Post that, I joined a private equity firm which funded P3 Health Partners in the same business. Um, and we took the company public in 2021 through a SPAC merger. Um, Post that, I started Curitics Health. And Curitics Health has been scaling, and we are so lucky to have great people working alongside with us. I also was Chief Digital and Technology Officer for Clever Care Health Plan, which we grew and scaled, to 25, 30,000 lives in 4 AEP cycles. And last year, I started in QVO Health because we wanted to increase the span of my and my team's impact to multiple healthcare companies and drive turnarounds and digital transformations and tech enablement um, across the board. So I'm very excited for this conversation, I must say.
Thank you, brother. Me too. And, one of the things that just drew me to you immediately was that you have the wisdom and the maturity of a guy twice your age, and a guy who is like has learned from mistakes and from successes alike. And that just reminded me a lot of myself. We both come from doc moms and medical families, and I think they would all say that we were the smart ones that did not become doctors ourselves, and instead went into services and technologies and stuff around healthcare, but not getting into direct service ourselves. And I've always been a big believer in Mesh, in that you always learn your greatest lessons from mistakes and from failures, and that those are always opportunities to learn how to do things better. I'm a behavioral economist by training, so I'm all about incentives and how you get people to be incentivized in their work, to do better, smarter, stronger work every day. So I know that one of the things that we wanted to do on this podcast and with our guests was to share some war stories, and to learn from some of these hard lessons that have defined our careers, and to really encourage people that that's really the way that you become better at this stuff, far more than from your successes. And so I'll go first with a confessional, if that's okay with you and Miss.
Absolutely. Go for it.
So
Go
the
for it.
year that we were selling Gorman Health Group, one of our big spin-offs was a technology company that we had built this software to handle both inside and outside sales for Medicare Advantage plans, and to manage appointments, scope of appointments, and commissions for sales agents and brokers. And it was a wildly successful piece of software. We sold it into over 50 plans. And I think in our third or fourth year of this product, as we're going through the summer in the run up to the open enrollment that starts in October every year, of course, in Medicare Advantage, I've been checking in with my tech team on this product to make sure that everything was going according to plan, because we had a major update of the software that was coming out with, that reflected a lot of the changes in commission policy that came out of CMS. This was during the Obama administration. And everybody was like, everything's fine, everything's cool, we're going to be ready for AEP, everything's great. And then 2 weeks before AEP, I said, okay, I want to see it. I want to see a live demo of the new software. And we flipped it on and it didn't work. I mean, it didn't work at all. Like, it was a complete crash and burn. And I would never wish that feeling on anyone, that in the pit of your stomach, just, you feel your butt pucker up, your stomach just clenches, and it was the worst feeling in the world that we had over 50 plans 2 weeks away from open enrollment with no functioning software to manage their entire sales process. And it was like one of the worst panics that I've ever gone through. And what we ended up having to do was to literally open up a couple of aircraft carriers, hangars rather, with just rows of machines and workstations with people doing all of this work manually on behalf of these 50 plus plans, just to try to get them through AEP without damage. Because we were in the home stretch of selling the company. I'd been doing this for 23 years. I'd had enough. And then to have a disaster like this occur at the dawn of AEP, and right as you're in the home stretch of selling the company, was just an absolute disaster of the most epic proportions you could imagine. So it almost tanked the deal to sell the company. It knocked $40 million plus off our valuation. And I had to go and do an apology tour to over 50 CEOs or product managers in a span of 3 to 4 weeks, just
My
to
God.
take full accountability for what had happened and to assure them that, we were going to make sure we were doing this best we could manually, so that they wouldn't be damaged in their enrollment numbers for that open enrollment period. And it worked. We got through it. But I've never had a worse moment in my entire goddamn career. And what I learned from that, Unmesh, was inspect what you expect. I think if I have any faults, and I have many, the biggest one may be that I trust too much. And
Yeah.
I'm a big believer as a behavioral economist in giving people autonomy in doing what they're doing, especially when those tasks are complex.
Absolutely.
That what people doing complicated shit want more than anything is autonomy. And
Autonomy.
oh my God, did I learn that lesson? And it's kind of an extension of Reagan's trust but verify. But
Trust
man,
but
that
verify.
was the most painful lesson in my professional career.
So let me break that down in terms of the number of applications that you guys managed manually. And for the listeners and viewers of this podcast, that's not an easy feat,
Oh no.
because manual processing of enrollment application involves not only you reviewing and submitting it out to CMS and authorities, but a lot of those applications are not good. You got to work back with the brokers and agents to make sure that they fix the application and resubmit. So 50 health plans, I'm assuming,
2 aircraft
10,000
hangars
average.
full of people doing this.
Wow.
Absolute, complete, total shit show. And it wasn't just managing the applications in Mesh. It was managing the inbound appointments, the scope of those appointments, to make sure that they had actually asked to talk to a sales rep. Oh
Yeah.
my God, dude. And then, of course, you got the brokers doing all their usual stuff, like, you know,
Yeah.
not even knowing that the software was broken. And so, like, many of them driving around with stacks of applications, completed applications in their trunks next to their golf clubs that they don't even hand in for, days or weeks. And oh my God, dude, that we got through that at all was a
Yeah. And
testament to how badly my folks wanted to make good on this absolute shit show of a mistake.
which was my next point is what you guys pulled off is it's
Yeah.
unheard of. It's like basically running a very, very large brokerage, you know, standing it up in a short span of time
And then having to do it
and
all
running
on
it through
paper.
the,
Yeah.
yeah. So kudos to your team as well. I mean, this is not the first time I've heard that softwares at the right time will decide not to work, but this is a tremendous story. Well, I don't have a this crazy of a story like yours, but I'll give you
Please.
one which as we are talking about the panic attacks, when we started Curitex Health, our first client, we started alongside with them. And these guys, they were doing risk adjustment annual wellness visits for on behalf of health plans at patients' homes, within the clinics. Um, and the risk adjustment season, if you may, like the actual annual wellness visits, the rubber hits the road sometime in August. You know, living up to end of December is where people are running to get
Right.
the annual wellness visits and, appropriately coding them and submitting the data and all that good stuff. Either which ways, we were moving from our version 1 of the software to version 2 of the software, which was supposed to be like this big shiny object. It's going to automate pretty much their entire lives. Their life will be a bed of roses, all the users. That's how we were seeing it, right? And we've gone through 6 rounds of testing internally. We've gone through like 2 rounds of testing with the client. This thing is like bulletproof, the next version, right? And again, um, trust, but verify. The leadership team at Curitex, this can't. We had that Titanic moment, right? Like nothing can break this. you know, I was like, hey guys, should we like push this go live out to maybe January, since the time of the year will be will be better for us. But they're like, no, we've signed 3 more contracts. You got to get into implementation in January, so we should do this mid-November, right before Thanksgiving. I'm like, okay, I mean, everything is tested, ready to go. Let's flip the switch. Let's upgrade. And it's the thing with software. When you think that it's gonna work the best is when it dies on
Yeah.
you. So we upgraded it, and the new version just crashed and burnt like no one's
Oh,
business. It couldn't handle the pressure test of data because these guys were managing over 1 million lives and they had multiple data points. They were loading data for last 5 years for those million plus members, and we are a new company. So it was interesting. I still remember with my onshore and offshore and my leadership team, Danielle and Chris, we were up. It took us, and the way we designed it is it was very hard to do a rollback of the code once you flipped it over. So I still remember 5 days to a week, John. These guys are in the peak of their AWE, our client. So they are out there doing AWEs and the system crashed. And now we can't roll it back and we can't roll it forward. So we are like, hey, why don't you guys go ahead and do it on paper? Let us get this thing moving. So I still remember probably 5 to 7 nights. All we used to pull all day, all nighter. One of us will be up in the night. The other one will start at 4 a.m. with the team. Our teams in India and US were taking shifts. And we basically 8 months of work, we undid and redid it in 7 days. And we basically upgraded the tool, got it ready to go. And then um, 80,000 or 90,000 AWVs these guys did. We are a tech company. We are a SaaS company. Have no idea about like how BPaaS or BPO works, but we had to deploy almost 20 coders and transcriptionists to then take this paper and begin keying that into the system and making sure that it flows through the system. So that point of time, we stood up a BPO as well. Um, but it was a big lessons learned um, around the trust, but verify. Um, Also, I feel like these horror stories make you better. Now we do much better on our upgrades. We don't haste. We had so many lessons learned. But this was one where I actually lost I'm a pretty chilled out guy. I don't lose my sleep otherwise. But this was one moment where these guys are like, hey, this is gonna have a millions of dollars or impact. And these guys are our first client was a smaller client. For them, the dollars,
Were a
that
big
they were
deal, yeah.
important. It was a big deal, and we had to show up and move forward. So that's kind of my confession, if you may.
Absolutely. And I'm glad to have heard it. I mean, it really is just kind of emblematic of what I admire most about you, Umesh, is, like I said at the top, that you've got the maturity and the wisdom of a guy twice your age. And I think that, that really is a testament to the strength of one's personality to be able to look at a mistake that epic and to get past the shame and learn the lesson that we have to take away from that to be better executives in this crazy ass industry that we're in, right?
You have to be a little cuckoo.
Yeah.
I tell that to my team all the time. You have to be a little cuckoo to be in healthcare, especially like if you're a healthcare technologist, John. I'll tell you, most of my friends who went to engineering school with me, a lot of them work at the FANG companies, they're at Google, they're at these big consulting shops. Um, Busy, but also making a lot of money and doing a lot of broader consumer impact. And they keep asking me, hey, this and these some of my friends who I've known for years, they're like, healthcare was supposed to be your sabbatical job. What the hell are you doing in there? I'm like, man, healthcare is one place. Once you get in, it's just hard to get out, just because there's so many things, so many problems to solve
Yeah,
for.
exactly.
And you just have to be a little cuckoo to
It's
be in
just so
healthcare.
profoundly broken in so many respects that there's just, loads of opportunities to find your niche to try to fix small pieces of what's wrong with our healthcare system. And then to try to build on that. We always took the approach at Gorman Health Group that the consulting practice was our eyes and ears. And we used
Right.
it like an R&D lab so that when we saw, half a dozen or a dozen of our clients that had the same problem, I'd get my kitchen cabinet together and we'd say, is this something that we can write a piece of software to fix? Is this an
Right.
outsourced service that we could do better and cheaper than our planned clients could? And
Right.
that worked very well for us. The irony was that by the time I sold it, it's like the consulting practice was probably 20-30% of our total enterprise revenue, but I spent 70% of my time on it just because consulting is just such a huge time suck.
It's a
And
time suck.
every year we debated, should we just shut the consulting practice down so we can just focus on solutions? And every
Right.
year, we reluctantly made the decision that no, we have to keep doing consulting because that's where we're getting all of our best industry intel. And
Yeah.
so it was a very interesting process for us to take that kind of market intelligence and turn it into product development in terms of identifying opportunities that needed a solution. And what it really was the essence of entrepreneurship, that you're finding
Exactly.
little discrete problems that, if you dug in on, we can fix this. And, one of the things I'm most proud of after talking about our greatest shame, and I'd love to hear what you're most proud of at this point, um, was that all of those solutions are still in the market today. And Signify is, a $10 billion a year company now. That was our biggest spinoff. We had always been the market leaders on risk adjustment, first with a little company in 2008 called Leprechaun that did all the chart reviews. And then when we
Yes.
sold that and got out of our covenants, we realized that doing house calls was going to be the next state of the art in risk adjustment. And that's where Senseo came from. And then that became Signify. And, those were a couple of the things that I certainly was most proud of in that phase of my career. And I'd love to hear what one of yours is.
Um, to be honest with you, for me, I think the what I was most proud of, and there's been many moments. I cherish my wins with my team. I think that's a very critical part of your growth
Yeah.
journey as an individual and with the people you're working. Um, but to be honest with you, like we met 2 weeks back in person in San Diego. Um, and to me that was a big um I was just sitting there like a little detached. I was talking to my wife and I'm seeing all the teams of people and the cheer on their
Yeah.
face and happiness. And I was just talking to my wife and I'm like, did you ever imagine? We both went to school together in
Oh, I
India.
didn't know that.
Uh,
Oh, that's sweet.
yeah, we both went to same school. She was computer science.
Wow.
I was a less smarter one. I was the
Smart man.
electronics major. So we were just sitting there and looking at the team and we were just so proud that
Yeah.
we bootstrapped both in QVO and Curitex to profitability and growth. And just looking at the people we've brought in, to have you there, I mean, that was a big it. And thank you
Oh,
for
it's my
cheering for
pleasure.
us
Yeah.
there. For me, that was a big moment. Is like, hey, we've built all of this, and this is great.
We're happy
Yeah,
and
but
doing
over
great
the
work. Yeah.
they're doing great work. They're happy. We are able to build that work-life balance. They're solving hard problems. Um, but they are all in this
Yeah.
together, and the sense of team and belonging and mission was very clear. And that was I think it was a proud moment for me. On the work side, when I was at Optum, we built a platform which was called Argon, and it was a risk adjustment engine which was being used by multiple businesses within Optum. And I was talking to one of my colleagues, and he tells me, it's been a while since I left Optum. We built that tool sometime in 2013, 2014 timeframe. And he tells me, hey man, like this is still functioning and working, and it's crunching all the coding and AWVs and data submission reconciliation, all of that. And I was like, this is great. I thought this would be replaced by now. They're like, nope, you guys, your team did a great job. And a lot of people who built that are working with me now at
Yeah.
Curitex. And it's a big testament to, all their hard work. I wanted to ask you a question, John. Like, you know, as I talk to you, there are so many stories, personal, professional, wins, losses. And I mean, I tell you from that offsite, a lot of my teams were reflecting and they were like, we just sat down with John and we couldn't, like, the stories were real and relatable, but also the scale of that, right? And, and it's the same with me. What's your biggest did you ever have like a epiphany moment in your career where you are like, okay, whatever I've done till now, it it's good, but I really want to take this to the next level and get to the next level and amplify impacts. Um, what's your view of, and there are these cost pressures, and a lot of payers and risk bearing groups are very bloated in terms of their administrative expense and systems. They've have systems that haven't been modernized, even with the onset of AI and
Yeah.
other things since years. How do you see the market right now, and what do you think is, how can some of these payers and risk bearing providers and ACOs really, get to a point where they operate um, in a way which is more sustainable
Yeah.
rather than, going
Yeah.
underwater?
I mean, I think anytime you see this degree of chaos in the market because of this administration, and that all these guys are about is move fast and break shit. We're seeing a slightly steadier hand at CMS. I mean, Dr. Oz is, I still think, a snake oil salesman and just should never have been in a policy making role like this at all. But he does have a steadier hand on the tiller than certainly the Secretary of HHS, RFK. And that, what really makes sense in chaotic times like this is to return to fundamentals and to get back to basics and to make sure that we are taking care of the core things that this industry is here to do. And so, yes, there are going to be lots of changes. We know version 28 is moving forward on risk adjustment, and we know that at some point, this agency is going to figure out how to do these RADV audits and really get to the bottom of upcoding in risk adjustment, and that we will revert to the mean in terms of what risk adjustment coding gets you. We are seeing huge changes in star ratings in the quality bonus program.
Absolutely.
They've completely annihilated the whole health equity index. We're reverting back to member experience measures. Cut points are going up. I mean, the entire industry is on a star ratings treadmill, and these guys just keep pushing the button that makes the ramp go up and the belt go faster. Okay, so to my thinking, stars and daily performance is really where the battle's going to be. It'll be less about risk adjustment and more about making stars work. For instance, company I've been advising for years just missed their 4.5-star rating because of one member on two different measures. So they had one member that missed in two separate measures, and that dropped them from a 4.5-star to a 4-star. And it cost them about $18 million in bonus payments. Two members. So, I mean, to me, that really encapsulates what this industry's up against, that this is really now going to come down to micro groups of members, what their experience is. Are they getting all of the services that they're supposed to? Are they getting all of the supplemental benefits that they're entitled to? And things of that sort. And to be able to be that specific and that micromanaging, if you will, if you are a senior executive of a Medicare Advantage plan or a Medicaid plan for that member with the massive cut in enrollment that's coming, it really is get back to basics time. And that's why I think what we're going to do with this podcast, Unmesh, is so important, because this is going to be, we actually may have called it Curitics Confessions instead of Conversations.
I agree with you.
But that, we want this to be a place where we can learn from lessons, that we can speak frankly and freely about how we do a better job because
Yeah.
uh, what is it? An old Chinese proverb that said, in chaos there is opportunity. How do we meet basic human needs in our plans? Like
Yeah.
this isn't going to be about silver sneakers and gym memberships and shit like that anymore.
Yeah.
This is going to be about your food benefit. And,
Yeah.
can you get people transportation to dialysis? And
Yeah.
can you provide them housing when, they're couch surfing and it's bad for their health?
And one size, what I'm hearing from you is that one size fits all will
Oh
not
no,
work.
not at all.
Uh, it's time for a more individualized,
Nimble,
cohorted,
responsive.
nimble execution.
Exactly.
And and I think that brings all the more need of upgrading your data so you can understand not just your populations but also individuals. Your ability to have very tactical execution or clinical intervention layer, which is enabled by AI, which is enabled by a lot of automation to help the people who are actually running these interventions. These can be clinicians, these can be social workers, these can be RNs, nurse
Yep.
practitioners who are driving this day to day engagement and clinical um, care uh, at the place of service, which is best suited for the individual. And it cannot be at the grassroots level. The executives, the CEO has to have a view of how this is operating in a way where they keep pushing along the star measures and the quality and the managing the
Yep.
utilization, medical costs, prior auths, and all of that, um, which I think is a great opportunity for us as well as Curitics and for InQvio, because we built that operating system and we have the people who have seen the top and the people who are at the grassroots level driving these clinical
Yep.
interventions and implementations. Well, this is going to be fun, my
Yes, it will,
friend.
brother.
I am looking forward to many more such conversations and also working with you very closely. I feel like Gorman Health Group was so ahead of time when you started it. I also have a feeling that now there's a lot of private equity and venture money and all of
Yes.
that. But when you started, I'm sure it was not as big in healthcare, and now it has just
Yeah.
exploded. What you did with Gorman Health Group is kind of where we are at, and we want to be that and more. I'm just very thankful that we have a advisor, mentor, and colleague like you.
Well, we'll be leading the way and benefiting from the many, many scars on our asses, right, brother?
That is right.
And so,
That
I
is
think
right.
what we're really going to do with this podcast is, really look at lessons learned and, to really speak with uh, folks who are real visionaries in our
Mhm.
industry. I'm really excited to bring back our mutual dear friend Sachin Jain from Scan Health. He'll be joining us at some point in the next several weeks. We'll be looking at folks at the operational level who've really distinguished themselves and solved an intractable problem in their plan or their community that they'll share those lessons with us. And I think this is going to be a great way of looking at our industry from multiple viewpoints, from a policy standpoint, an operational standpoint, a leadership standpoint, and really trying to bring some perspective and lessons that will save folks some of the heartache and the butt pain that you and I have gone through, and the folks that will join us in these conversations as well. So I'm really excited about
Absolutely.
that, and to be back on the mic with you is just going to be a blast. So I think everybody can expect to hear from us, some frank and honest discussion. I don't know how to do this stuff any other way. I'm pretty sure you don't either. And
That's
with
the
some
only way.
really incredible guests that will help bring insights that you won't get anywhere else. So with that, thanks for having me, Unmesh. It's a delight to be with you and the amazing team you've put together. And I'm really excited to get cooking with Curitics Conversations.
Let's get moving, my brother.
Okay.